Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
And I'm Andrea, the physio.
On today's episode, we're going to talk about walkers, why we need them, and how to use them properly.
Basically, how to walk after you had your hip or knee replaced. Okay.
So first question, Andrea, a lot of patients ask, does it matter what kind of walker I have? My neighbor has an old walker from 1974. I would like to use it.
Probably not the greatest idea. The type of walker we usually recommend is a two-wheeled walker. A lot of people use rollator walkers, the kind with the four wheels, the brakes, and the basket, and those are actually pretty unsafe to use after surgery. Those are made more for balance, whereas a two-wheeled walker is used for weight bearing, pushing through, and you will be pushing through quite a bit through your hands to unweight your sore leg after surgery.
Okay, well, should we take a look at some walkers so you
Let's
can show the difference?
Yep.
All right.
As I mentioned, a lot of patients preoperatively use a rollator walker to ambulate with. As you can see, it's got four wheels, it swivels, it's got brakes and a seat. It's great for balance, but after you've had surgery, you're going to be putting quite a bit of weight through your operated side. So you would essentially have to press the brake every time you weight bear through your operated leg. And if you were to forget at one point, the walker could swing out from under you and you can end up on the floor having a fall. So this is not a recommended gait aid for post-surgical. Two-wheeled walker is what we recommend. So as you can see, there are two wheels at the front, nothing at the back. You can have skis put on the back. They look like little skis, they're about this big, and they help glide from surface to surface better. The way you'd measure your walker is at your wrist crease. So stand up straight and the top of the walker should reach your wrist crease. So when you're leaning on the walker, your elbows are slightly bent. So proper gait sequence is, if I had my right leg done, I would push the walker forward, step with the sore leg first, and then step past with your unoperated leg. And you're pushing the weight through your hands as you're stepping on your operated leg. The tendency sometimes is to do the wedding march and just walk like this. We don't want you doing that. We would like you to walk as normally as possible from the beginning. So you push the walker forward, sore leg, and step through with the good leg. Sore leg and good leg. Walker, sore leg, and good leg.
Okay, Andrea, that was a great demonstration of how to use a walker after a hip or knee replacement, or I guess anytime you're in the hospital and you need help, some sort of walking aid. What about transitioning to a cane?
So everyone's a little different for which point they would transition to a cane. Your physiotherapist can sort of guide you when it's appropriate to transition to a cane. We do get a lot of questions about what hand to hold the cane in. You would hold the cane in your opposite hand to your operated leg, and it would be measured the same way. So the loop of the cane would be at your wrist crease.
On a rainy day, can you use an umbrella instead?
No.
All right. Well, that was great. Thank you so much. As always, you really helped us out here understand how to ambulate, how to walk with a walking aid after you've had surgery.
Very useful. And if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.